Good morning. Thank you so much for joining Forge Breast Cancer Survivor Center's coffee conversation today. We have Herbert Gooden the second here. That just sounds so formal, the second. So we're excited to have you here this morning to talk about emotional health while navigating through breast cancer. So we're kind of going to unpack that topic with Herbert this morning. And before we start to talk about the topic, if you could just kind of tell us about what you do, a little bit about yourself, so that everyone can get a little bit more familiar with you.
Okay, well, good morning, everyone. And thanks again for the invite, uh, Janita, and definitely happy to be here. I am Herbert Gooden, as said, and I have a private practice at the Children's Hospital of Alabama. I'm a stress management specialist, and at the hospital, I work with the staff, the patients, and the patient's family on stress reduction and stress management, which includes I provide somatic work, which could be actually clinical massage or mindful movement. And also I provide mindfulness trainings as well. So I also do lunch and learns for the counseling staff and the medical staff. And I've been there for 12 years. I've been a clinical massage therapist and mindfulness teacher for over 20 years. And I began this journey when I walked away from the corporate world. I had been involved in communications and engineering for 25 years and got to a point where it was challenging my integrity, as well as my life as in general. Basically, I was being asked to do a lot of things I didn't really think was conducive to a good work environment and well-being of the people that I was over. So I walked away and I haven't looked back since. And so here I am today. This is what I do.
Well, you do a lot of cool stuff, and we're glad you're here today. And so I heard you say that you help people with mindful exercises and things like that. And so if you could kind of tell us or break down in your own words, what does mindfulness really mean? And how does someone practice mindfulness?
Okay, mindfulness is simply being aware of the present moment with being non-judgmental. And what I mean by that is just like now we're on this Zoom call, right? I'm very aware. You just asked me a question. I'm totally focused because I have to respond to you, right? And I'm going to respond from what arises now. Although it's going to be pulling from my memory storehouse. That's right. It's going to be pulling from my memory storehouse. But I'm going to provide what is needed at this moment in time. So, not thinking about the past, not projecting into the future, but being here right now with you, specifically as I see you on the screen, and the rest of the audience that's out there. So that's it's very simple. It's been complicated prior to the last 7 to 10 years. It was very complicated to society, but awareness has been around all the time. Even if you look at religious studies, the present moment, all that's been very much so within us. A lot of religious traditions.
Thank you so much. I can tell that you practice it. You have a very like smooth type of vibe going. And I feel like that kind of like helps with mindfulness, like shifting your energy a little bit. So in this conversation, we were talking well, we wanted to kind of cover what does emotional health mean? Why is that important? And how does somebody recognize that their emotional health is not where it needs to be?
Mhm. That is what I see pretty much in my practice all day, as well as this past weekend. It's been Mother's Day. Happy Mother's Day to those past Mother's Days, those who are there. I was at the resort. They needed some help because they had an overflow. So many mothers showed up at the resort at Ross Bridge this weekend. So I went in there actually to do some massage work, right? And so what I see is that our emotional disposition shows up in the body. And when it shows up, it causes tension in the body. And then by it causing tension in the body, that tension returns back to the mind. So it develops a loop. The body is experiencing tension because of stress. Now, since stress is on the body, now the mind is experiencing emotional challenges, which will be increased according to what the challenge is at that particular time. So what I see on a regular basis is people having difficulties with self-regulation. And when I say self-regulation, we're talking about pretty much like a homeostasis, but at the same time, not being overwhelmed. So I see so many people who are coming in who are overwhelmed from either physically or emotionally, as you're speaking about. And a lot of times the emotional, if it's not in the present moment, is because of what they brought into the present moment from the past, or it'll move into anxiety, ruminating on what's in the future. So that is what I see with clients daily. And so I provide them different tools and resources to use to start to help them to work through some of those challenges.
So, how does someone kind of differentiate that, right? Like, for example, I got a birthday coming up and I feel like my back is hurting more, right? So, is that because I'm stressed about my birthday coming, or is it because it's something physically wrong? That can become like a battle, especially when someone's diagnosed with breast cancer and they've got all of these physical changes that are happening. So, how does someone know necessarily which symptom to treat first, if that makes sense? Because when a person is diagnosed with cancer, I'm sure you're aware, but they're going through so many different changes physically when it comes to surgeries and their treatment. And so that's something that can't necessarily change in the moment, right? But like the side effects of that, do impact how they feel and how they think and how they navigate those things. So, what tips do you have to kind of help someone differentiate, like what's your main stressor? Is it the emotional or is it the physical? Is there a way for someone to kind of tell the difference? What are your thoughts on that?
Okay, first and foremost, remember whatever is going on with us emotionally and causing stress is going to show up in the weakest part of our body, which means that if I have something already that's been predisposed to injury, or in the present moment, say for instance, that you notice that whenever you're under a lot of stress, that your back is tightening up, well, it's normally going to show up in that area outside of something actually physically causing that, right? And
Mhm.
so what it is that we have to start monitoring our body. Ask, how do I know whether it's the my back hurting and it's causing me tension, or whether I'm having tension causing my back hurt? We have to be aware and then just start noticing exactly when is it showing up. I always say we're our best ourselves. We're our best. What can I say? Within being a patient of ourselves, we can diagnose, not diagnose, but we can be aware of what's happening within our body system more readily than someone from the outside, because we're with our body 24/7, anytime that, each day that we awake, it starts that monitoring system, right? So I would say notice when it's showing up, and then also notice what is going through my mind at the same time. And I also instruct clients to do this. Look into that pain. Look into it. If you're experiencing uh your back starts to hurt, Just stop for a moment and look into the pain for a moment. I will even challenge you to ask this question. Why do I have to have this pain? Why do I have to have this pain? Because what I'm hearing, what you're saying, is that you're trying to differentiate between the two. So soon as I ask the question that disengages the right side of the brain, it gets analytical, which means that any ruminating that's been going on, which comes from the right side of the brain, is detached. So immediately we'll relieve ourselves of the emotional cause that could be possible of the pain. But now we can look at the pain and experience it. And just by noticing it, it starts relieving the pain to some degree. So my answer to your question is look at the pain, then ask the pain why it has to be there. And that way you'll be detached from the emotional part of it. Now, if the pain becomes even more severe, it's going to try to again arise, right? And that's when you asked me a question earlier about could I share at least one mindfulness exercise for you? Well, this is the most important tool that you have all the time. Is notice your breath. We breathe all the time, and it's the most readily available tool. So simply noticing the coolness as you're breathing in, or the rising of your chest as you're breathing in, or the raising of your belly as you're breathing in and out. Just focusing on one of those that's most sensitive to you, again, takes you out of the right side of your brain, which where all the emotion is stirred up, right? And for that moment in time, it will go ahead and knock that offline. And again, taking your mind out of it, but focusing on your body.
Thank you so much. You can tell your classes go well because I feel like I'm doing a mindfulness thing in this moment. And it sounds like a lot of it does like come back to your thought process when it comes to things you're experiencing, emotional or physical. So thank you for, bringing that to the forefront. And so I did have another question, and I wrote it here. So what role does mindfulness and stress reduction techniques kind of do to help individuals specifically like with breast cancer? Like what are some things other than, the exercise that you just showed us about like, hey, taking a moment to um, be present with yourself because you're with yourself and you can breathe in this moment. Um, but what are some other tips that individuals who are experiencing a lot of emotional irregularities as they're navigating all of these different changes because losing your hair, your eyebrows, all of the other things that, aside from a mastectomy or a lumpectomy, or it's just so many different treatment options and side effects of those treatment options. And so sometimes maybe, yeah, I could be present with my breath, but that's not feeding me right now. What are some other things that you think would really feed somebody kind of in the thick of like navigating not just the physical, but the emotional and the identity and the imagery that changes with this diagnosis?
I could say I've been fortunate and very blessed to have worked with literally probably hundreds of survivors over the years. Out of 15,000 plus clients, I've seen hundreds. And from those who actually had to have the operation to remove a breast, to the chemotherapy, to everything that you mentioned that has taken place in their physical body. I've seen how it's taken, takes the energy. I have an associate at this time who's going through radiation treatment for breast cancer. And I saw her yesterday and talked with her, and she appeared very weak. But of course, I continue to encourage her with things like prayer, meditation, those things. And what I try to do is basically turn the mirror back on myself and try to imagine if I lost a part, which I have which society has, that people have identify me as a male. So without getting into detail, right? And so I sat there with it, and I always think about wholeness whenever I work with survivors or those who experiencing it. Because what I can feel is it seems like something had just been snatched away from them. And again, I turn the mirror on me. How would it feel someone just take away from something from me that I identify with so much? And so it comes back to wholeness. And my personal practice is moved to a place where certain things over the years that have identified me as a male no longer are necessity for me. And that has taken practice, maturity, all the things that goes with,
Yeah.
counseling, therapy. I've experienced counseling, I've experienced therapy. It's taken a lot of things to get to this point. So I don't want to make this lightly to anyone, right? But what I'm saying is that wholeness means physically, emotionally, mentally, and spiritually. How do I feel in these stations? Because how I feel in outside the physical part, which I'm experiencing, my mental and spiritual self is going to have a bearing on it. And when I mean spiritually, I'm not defining any particular religion, because what's spiritual for one person can be spiritual for another. But what do I have to draw from? Because I need to really focus on wholeness of me being a whole human being, regardless of my parts of me. My parts of me do not define me. How I feel about myself emotionally. And me, I am a spiritual believer. And so what I draw from and realizing that I'm complete regardless of parts. That's not making this lightly. I'm just giving you some suggestions of some things that you can start on. Uh, in my practice, I've had ladies just take the wigs off joyfully. You know, I've had those who had scars uh, would talk about some of the therapists they work with, and in order for them to work on the scars, working through those, right? And so, what's going to have an impact from what I've experienced and seen through the clients over the years is where am I today in my wholeness? Each day, the human system needs something. And when they're going through therapy, it is really having a havoc on the body and hormonal especially, right? From hormones perspective. So our body to feel in a good space, I say, need a good dose each day. So a good dose is the D is for dopamine, the O is for oxytocin, the S is for serotonin, and the E is for endorphins, right? All these are God-made ingredients in our body that are excreted according to the situations we're in. But it's designed to rejuvenate our system, maintain our system where it's in a good space and place. And when we have an injury, anything that impacts the body, havoc is going on with these hormones. And they are affecting us very much emotionally because that's what help controls our emotion. So what I say first is, what can you do for yourself? What can you do for yourself out there? Those who have had operations, going through chemotherapy, having physical challenges, emotional challenges, you might not be able to go to work, all these things, I know they happen. But what, like today, what can I do for myself? So these are the things that I can at least give you to help put you in a better space. And it's seeds. 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 Just remember the acronym. So remember I talked about dose. Dopamine, oxytocin, serotonin, endorphin. So I'm telling you some of the things that help build those up. Because even myself, I have a degenerative disc in my neck that's causing me consistent problems. I have a degenerative disc in my back, but I still show up. In my private practices, I still do all types of physical activities. I refuse to bow down that I'm going to be, disabled from doing the things I love. But this is what involved. So when I say seeds, we're going to talk about some things that feed the dose per day. So S is you need to be in a social environment. Because when we are in a social environment, just like right now, you're through the screen, oxytocin, our bonding hormone, is being secreted right now as I speak amongst us. Because I'm amongst friends, I think, today. I can say all you are my friends, right? And so oxytocin is the same bonding hormone that helps mothers attach to their child and lactation, all those type things take place, right? But being social feeds that ingredients where people in illness, psychologically or physically, feel alone. So what are those things that you can put you in an environment or a place where you don't feel alone? Because when the body feels alone, it's at its weakest moment because it feels like it's been extracted from the tribe. It's no longer socially attached. And it not being socially attached, it started to unfold and not producing those hormones. The E is for exercise. And I understand in some cases that some of you are going through therapy or have from physical effects of some surgeries or a little limited on your exercise. But just think of what can you do. You can do head exercises. Go online to look to see what you can do with your arms, your legs without being overexertion. Do anything, a little movement. And then guess what? It's even good. Watching other people exercise, we have in our body what we call mirror neurons. And these mirror neurons try to match up with what's going on outside with another human being because we're always trying to be social. So those mirror neurons are set up to make us, just like as I look at your screen, without even doing it consciously, I'm kind of matching up with your demeanor. I'm kind of observing your eye movement. I'm observing your head, smile, all those things. So watch somebody exercise. Go to some event where people exercise and even you can't exercise. You're doing two things. Your mirror neurons are saying, well, I think this is happening inside of me, but also I'm in a social environment, right? So exercise. The next E is education. And when I say education, I'm not talking about just formal education. Our body system loves is a curious system. So education means learning anything new. The body loves new things. It loves new environment. It loves trying new recipes. It loves washing the dishes different. It just loves anything that's new. Our system loves curiosity because back in the savannah days, curiosity could find us a new place to dwell in, a new place to eat, a new friend. So those things are very present deep within us now. So let's move on to the D, diet. Very important because those nutrients are what's feeding our whole body system, and our whole body systems need some good nourishment. Food with all the essential vitamins, which in turn is going to help our system always try and return to homeostasis. It's always trying to return back. Remember, our system is a self repair system. So it's always trying to return back to the state. So that is important. And the most important one on this planet, sleep hygiene. Sleep hygiene. No sleep will completely rob to the point where you can even become psychotic. Insomnia will lead to psychotic episodes during the day. So sleep. So that's what I'm saying with seeds. Do each one of those to your best ability, trying to optimize each one as much you can. And those can be some things that can help buffer that emotional state that you're in.
Thank you so much, Herbert. I feel like I'm serious. I feel like I'm in a mindfulness session talking to you. This has been so great, and I was writing down a lot of the things that you were saying. I like how you broke down. Well, dose is what we need to make sure we're doing. We need to make sure that we have these boxes checked mentally. But in order to do that, there are a lot of physical components to it. There are a lot of things. So, I mean, what I'm one of the things that I'm getting from this conversation is that, I mean, in order for this to be okay, we have to make sure we're doing certain things to the best of our ability with the flesh before we worry about, like, okay, well, I need to do this and I need to do that. La 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 la. It's all connected. And
Yes.
so thank you so much for, carving out the time to lend your expertise. And one of the ladies said, yes, it feels like this has been a mindfulness session. So we really, really appreciate you for kind of talking about this. I feel like there are a lot of things that we could continue to unpack, and maybe we can, have you come back again and kind of hone in some things for us as we continue to talk about how all of these things impact people who are affected by breast cancer, because
Mhm.
it's so wide ranged. And we're just thankful that there are professionals like you assisting individuals who are going through something as traumatic as this to help them stay as balanced as possible. We have
Yes.
enjoyed having you.
Yeah, well, thanks so much. I want everyone to know that there's more power for you to heal yourself than you could ever imagine. I've suffered a stroke, and thank God I have no residuals left from that. And so I know what the power of the mind can do, and we are uh, we are what the word of God always say. We are wonderfully made. We're created in His image. So that means we have creative powers, which means we have healing powers within us. I feel like what I do is complementary to what the medical do. It takes us all, you know, and also definitely those who are on different spiritual paths. I accept what the doctors offer. That's part of the process. Anything that is administered to you still was created by our creator. So I know that's one thing that I noticed too. Sometimes people have a little withholding about taking medication. Use it. It's just trying to hold off things while your body's trying to take back over. So just keep in mind, I'm taking this medication, but body, I'm waiting for you to come on with it, come on and
Usher you
empower me
along.
better.
Uh-huh. Like, I got you a friend. I just need you to catch up.
Yes, yes. So they empower you are very empowering. I hope some things you take into consideration some things I said, so you can definitely empower yourself. Because that's what I do with my clients, if they coming back for the same things over and over again. First thing I'm gonna say, have you been trying some of these tools that I've given you, right? Because it takes some time. It takes a while for us to usually get the disease, and it's going to take a little while. So don't be discouraged because things are not happening as fast as you would like them to happen. But within the process, continue to speak to your spirit and continue to know that you're not alone. You have platforms like this and all that support system. I would say utilize it to the maximum because in most cases I found that people like Janita and others want to help you more than you can ever imagine. So don't withhold from asking them questions and going to them for resources.
Yes, thank you so much. All of that was just so, um, I mean, it's just truly been like a mindfulness experience. I keep saying that, but it was really helpful to kind of, help individuals kind of see at the forefront that it all matters and it all works together. And like we have these medical teams and they're going to do what they got to do. And we've got to do that too. But our load doesn't have to look like their load. Our load looks a little different. We're not going to get it right all the time. And we're going to continue to practice it and give yourself grace in that. And so thank you so much, Herbert. This has just been absolutely wonderful having you.
Well, thank you so much for having me.